Hello, I'm Dr. P. Maheshwari, Associate Professor at SPS Vistas. Today, we're going to explore the topic of gastroenteritis, a condition that affects the digestive system, especially the stomach and intestines. Often referred to as stomach flu or intestinal flu, this illness can have several causes and varies in severity. But with the right understanding and care, it's manageable. Let's begin. Gastroenteritis, what is it? Gastroenteritis is an infection or inflammation of the digestive tract, particularly the stomach and intestines. It's commonly called stomach flu or intestinal flu, although it isn't caused by the influenza virus. Causes of gastroenteritis. There are several causes. Viruses, including caliciviruses, rotaviruses, astroviruses, and adenoviruses, bacteria such as Campylobacter and Salmonella, parasites like Entamoeba histolytica, Giardia, Lamblia, and Cryptosporidium. Bacterial toxins produced by certain strains of staphylococcal bacteria can contaminate food and cause illness. Chemicals like lead may also trigger gastroenteritis. Drugs, particularly antibiotics, can irritate the digestive tract and lead to symptoms in susceptible individuals. Infectious gastroenteritis. Several specific infections fall under this category. E. coli infection, common among travelers, spreads through contaminated water or raw fruits and vegetables. Campylobacter infection, found in animal feces, is spread by consuming contaminated food or undercooked meat. Cryptosporidium infection from parasites in humans and animals spreads through contact with contaminated water or surfaces. Giardiasis, another parasitic infection, spreads through contaminated water or close contact with infected individuals. Salmonellosis, caused by bacteria in animal feces, spreads via contaminated food or poor hygiene. Shigellosis spreads similarly, especially through unwashed hands. Viral gastroenteritis, caused by viruses in human feces, spreads via person-to-person contact or contaminated food and water. Symptoms of gastroenteritis. Typical symptoms include loss of appetite and bloating, nausea and vomiting, diarrhea, abdominal pain and cramps, body aches. The major risk is dehydration, which can disturb the body's electrolyte balance and lead to serious issues like irregular heartbeat. Watch for signs like dry mouth, excessive thirst, and reduced urination. Complications. If symptoms last more than a week or worsen, there may be a more serious infection. Warning signs include high fever, blood or mucus in stool, blood in vomit, or severe abdominal pain. These require urgent medical care. Diagnosis usually starts with the symptoms. To identify the specific cause, healthcare providers may use medical history review, physical examination, blood test. Treatment depends on the cause. Drink plenty of fluids and maintain a suitable diet. Use oral rehydration solutions. In severe cases, hospitalization and IV fluids may be necessary. Antibiotics if bacteria are responsible. Antiparasitic drugs if parasites are the cause. Avoid antidiarrheal or anti-vomiting medications unless prescribed, as they may worsen the condition by retaining the infection in the body. Prevention. To reduce the risk, wash hands thoroughly after using the toilet, handling animals, or changing nappies. Wash hands before eating or cooking. Use paper towels instead of cloth towels. Keep food at the right temperature. Cold food below 5 degrees Celsius and hot food above 60 degrees Celsius. Clean the bathroom regularly, especially high-contact surfaces. When traveling, only drink bottled water, even for brushing teeth. Avoid raw foods, buffets, and ice. Prognosis. Gastroenteritis usually resolves within 2 to 3 days, with no long-term effects. However, if dehydration occurs, recovery may take a little longer. Thank you.